I wanted to highlight the general information about Caborca, as well as what we've been doing in terms of projects. This is a Rotary District 7080 project. Um, Kitchener Rotary has been the coordinating club. So who's been doing it, how long, and what else has happened? The Rotary Club at Caborca was chartered in 1984, and it's got over 20 active and committed members. And it's the one that is the host. And from District 7080, over the few years we've been running, we've had participants from over 11 different clubs, and 7 clubs have already directly contributed funds to projects that help in Caborca. Now, I know that Hubert just said this has been going on for a long time. Actually, in Rotary terms, it's a new activity. We've just had 4 years, but we've done 4 yearly immunization visits for polio. We have funded hospital kitchen equipment, and more recently, we've got involved with project participation, and we've been trying to help with grant situation. Now, how did this happen? Well, the Rotary connections were made through participation in the long-running Rotary Nogales projects. So this just shows you a good Rotary project can lead to other good Rotary projects. As a consequence of getting down there, a Rotary golf game led to Hubert being asked by Caborcan Rotarians to invite a Canadian team to come and participate in a polio immunization. So there we are, and there's Ruben. Ruben was looking younger those days, but he's pretty good right now. So how do we get to Caborca? If you were involved with this, you fly to Tucson, Arizona. The next day, you drive to Nogales, Arizona, and then we walk across the border to Nogales, Mexico. And there our Rotary friends meet us and drive us to Caborca. Now, some of you have already seen previous presentations and know where Caborca is, but there are members here that haven't yet seen that information. It's in the northwest part of Mexico in the Sonoran Desert. It's, and trust me, it is a desert in that area. It's close to the east side of the Sea of Cortez. It's south of an area of inhospitable portion of the USA-Mexican border, and it's not just because of border protection, but it's a very mountainous, hilly, arid area. It has one major city, and that city is on road and rail transportation links. One of the things that interests us very much is that it has many small, poorly resourced, rugged villages inhabited by lovely, hardworking people. Now, Caborca is a regional center. So when we talk about Caborca, we're not only talking about the city, which is now over 60,000 population, but the region has a population of 80,000 plus. So Caborca, when we talk about schools, for example, we're talking about the elementary schools in the region. It's an old place in the sense that the mission was established in 1692, very early on. Industry and mining is important in the area, but agriculture is the largest employer, and it's very reliant on low-wage agricultural piece workers. And to give you a little picture of where it is, you'll see on the right, this color is the desert itself, and then this is the upland. This is higher ground, but it's also pretty arid. And so when you come into Tucson, you're kind of coming in where my little arrow is showing, and then we come down in through here. It's noted for the pipe organ cactus, very rare. It's only in the Sonoran Desert. You get that. It's part of the whole area is part of the Great Sonoran Desert. It's arid. It's brutally hot in the winter. And driving along the road, you can very often see this kind of a picture. So it's a rugged and demanding place. There's beauty in the desert and there's beauty in its people. Now, the asparagus capital, not only of Mexico, could well be of North America. It also has table grapes in large quantity. So when you go to your supermarket and pick up your winter asparagus, you're likely getting asparagus from Caborca. And how does that get onto the table? Well, it's mom and dad from these little villages that go out into the fields and do hard, back-breaking, tiring work. And you can see them stooping over in the field. This pictures I shot while we were there in February. Kids are left at home to be cared for, often in groups, by a grandparent or an older girl. And after the asparagus season, they continue on with hand picking table grapes. So those grapes that grace your table are coming from Caborca. Now, these field workers work piece by piece. They don't get medical insurance because you need a regular permanent job in Mexico to get medical insurance. These are poorly resourced little communities. Probably very few of them have a clinic. They have to go into the city to get help. We have been working in the village of Rancho El Cerrito for a period of time, and this is where we go to inoculate for polio. Most of the village homes are made of clay bricks. Some of them don't have running water and have poor sanitary conditions. So, take you to 2020 now. That was the little overview of the area. 2020, we had an opportunity to do polio immunization. Now, we didn't have as much chance to pre-advertise it as in the past, because with the change of government and in Mexico and some uncertainties about the availability of supplies, particularly the inoculation materials, um, was very late before we got the go-ahead that we could come and do the immunization day. Consequently, there was only 8 of us that traveled on this trip. Previous years, we've been up to 16, 18, and we're pushing 20 at one point. So 8 of us traveled to Nogales to the McDonald's, and you can see us down there, ready to walk across the border to meet our Caborca Rotary host. And on the way, we saw a moving day. This is how you move as you approach the border. We arrived at Nogales, and some of you would be interested in seeing. This is Nogales Mexican side. This is Nogales Arizona side. And this is the wall. I think some of you have heard about the wall. We keep hearing about it, and that's it up close. And we were well greeted in Nogales. And to be, clear, the real key actors are on the left there, and you're going to be introduced to this guy right here. That's Ruben. You don't know this fellow. You don't see much of him, except when he does make it to a club meeting. Now he can do more from Zoom because he can call right from his business. And old friends got together. It was the Valentine's Day as we drove through Nogales, and I couldn't avoid putting this slide on. This is only one of probably 30, 40, or 50 of these stands with all manner of things you can buy for your loved one to take home on Nogales, on Valentine's Day in Nogales. And I have no idea how they could possibly sell all that stuff. Right the next day, we start the polio immunization. We gather first thing in the morning, and there we have a bunch of happy Rotarians ready for training, because what we have here not only our little group, but we've got the visiting American Rotarians, largely from California, but there are individuals now that join, and I've met some from Tennessee and Oklahoma and Kentucky that come down and join this group. They come in on a great big bus, and they've been working for a long time with this immunization and helpful projects in Caborca. Now, we are helped in our work in the community by public health nurses. They come out with our team, and you'll later see our team. We had two nurses with us, so we could split into two teams. And there they are. They're very proud to do inoculations for their community, and we're very impressed because they keep excellent records. Um, they do training. They show us how to administer the drops. On the left are a couple of nurses goofing around, ready to do the training, but then it gets serious, and they're showing here, this is what you have to do to inoculate a child. You have to get their head back, get their mouth open, and then you're going to drop 2 drops of the serum in their mouth, being very careful not to touch their lips. So it's just the drops that go in. And by the way, doing the translation there and helping is Martine, who is a club member of the Rotary Club of Caborca and is a doctor. His wife, in fact, is the chief in charge of the local new hospital. And I had to include a picture of Mike. Mike is the U.S. team leader who has been bringing teams to Caborca for years. Probably, I don't know, at least 15 years. And not only have they done a lot of polio inoculations, but he's organized a lot of donations to particularly healthcare. The team are getting ready to go out into the field. And here we are, the Canadian team as at Rancho El Cierto. And we divide the team into 4 to 6 people. We have a public health nurse, and we go from door to door. And what I was saying, I'm impressed that the public health nurse comes to that community with a printout that indicates who she should be finding and what their inoculation status is, not just for polio, but for all other children's immunization needs. And in her hand is the little booklet that the parent or guardian has, and she's cross-referencing. So this is the team in 2020. We've got Mexican Rotarians, and one of the wonderful things is we had 3 Rotaract individuals who came and were part of the team, gave a great spirit. Rotaract is very active in Mexico, and we're proud of these people. They're wonderful supporters to the project. So off we go looking for little ones. They're dusty lanes and it can be pretty hot there. And we have to rely quite a lot on the public health nurses to help us search out the children who were looking for the ones that are 5 months to 5 years old. And it's not clear to them exactly where the kids are going to be found because they may be today in some other house being cared for, as I pointed out, in a group setting. This is yours truly getting a chance to give the inoculation. Now, this kid was very upfront. He just marched right up to me and leaned his head back and opened his mouth. What a nice cooperative guy. In that community, lots of contacts, 140 done that day. And this is Paul Wallman, who's in on our meeting today, giving his inoculation to this person. And a typical visit is the nurses checking records, goes to this little house. It was quiet when we got there. Only the dog was there to watch us. And they called in through the curtain at the door, and out comes Mom. And right away, the nurse is checking the record, and Paul gets to do the inoculation. And look at the happy Mom. She's so happy this baby is now protected. And Saj, he's in on our call today too. There he is, giving his inoculation, and they're very proud. You notice how happy the mother is. And this is what Paul had to say in a presentation he put together for the Grand River Club. In this slide, this is his slide. Service above self. As a Rotarian, this is the most rewarding and highest level of service I can ever perform. It says it all. So that was our polio experience. I wanted to report briefly to those that weren't aware. We did do a hospital project in 2017. District 7080 clubs, should be plural there, funded $10K US dollars purchase of cafeteria equipment. This was solely club funded. 7 clubs coordinated by the Kitchener Club ponied in the money, and we equipped this cafeteria, which provides subsidized or free food for impoverished villagers that attend the hospital. And the Caborca Rotary Club funds the staff and arranges for the donation of supplies. There on the right, you'll see it's Kitchener-Conestoga, Kitchener, Palgrave, Bolton, Brampton, Mississauga, Meadowville, and Oakville, Trafalgar. And we all felt good about that. It provided commercially quality equipment, which is in use. And we've now found out that this equipment is actually being relocated to a new building, an ancillary kitchen building built right next to the hospital as a donation by a local mine. And this, of course, provides better food security and protects the hospital from cross-contamination and so forth, and food handling, and it's an advance. So we were there, and that equipment is moving into the new facility. U.S. Rotarians have made many important gifts for health care and also community water supply. They recently have funded a fully equipped field hospital on wheels that can go around the community and assist. We were there to see a large celebration of 2 incubators being donated to the hospital. So now they don't have to rush uh, um, babies and mothers many, many miles down the highway to a far distant hospital. And one of these incubators, in fact, is a portable one that can go in ambulances. That's just an example of the good things that Rotary is doing. Now, we did get involved more recently, 2018, 2019, trying to help with reading centers for elementary schools. Now, the Caborca Club, supported by Kitchener Rotary and 7080 clubs, initiated a US $65,000 Rotary Global grant to establish a reading center in each elementary school to help address the fact that literacy is very low, especially in rural areas. And the children have nothing of interest to read. We don't find books or magazines or anything in their homes. They're just scraping by. School reading centers would provide interesting books and a place for children to read, and books could also be borrowed, and Caborca Rotary had planned to offer reading awards. District 7080 clubs committed funds to support the proposal, It was approved for district matching, and the Canadian government matching funds were committed. Unfortunately, Rotary International turned down the proposal on apparently two grounds. One, they wanted a better arm's length local needs assessment, and this is becoming an important thing for any of you who are listening and are going to be involved with a global grant. An arm's length local needs assessment has become very, very important, far more important than it used to be in the past. The RI Review Committee also appeared to confuse reading centers in these little reading centers in schools with libraries. Like, where are the librarians is one of the questions. So we think that a revised proposal could be developed and reconsidered perhaps, but then COVID-19 set in. So that was where that was as we were finishing our polio work, and what was proposed to us by our friends in Caborca: would you like to help us with crosswalk painting? There are no painted crosswalks in Caborca, and the local Rotarians got together, a joint team, and we started one at the main intersection. There we are, painted a big white square. We've got a stencil, and the painters went to work. And there is one of our team members, Ava. Oh, there's Ruben in the back, and I think you know this guy. Actually, there's a better picture of me. Look how intent Hubert is on his painting skills. And he seems to be enjoying it. We not only have him, but we've got Saj, and we've got VJ, who was right here, all members of our team. So we got the sticky stuff done. There's Paul doing detail, and he calls us painters of action. So it was success for the team and for Caborca. And I think you're going to hear that they're thinking of doing more of that with more crosswalks in the city. They're great people for hospitality. They provide us a wonderful shore lunch and cared for us at their clubhouse. It's a great place to return to. We hope some of you think in the future of coming down and joining a polio immunization mission. Looking forward, while COVID-19 has hobbled projects this year, it's not clear that we could do a polio inoculation trip in 2021. But at the same time, Caborca Rotarians are looking for ways to help their community. They're looking at elevated water tanks, interactive classrooms, rescuing schools, and I think they may have something to say to us. That's the end of my presentation.